So hydrotherapy, theory and practice. This is part 22 of a series on hydrotherapy. So just a reminder, as you navigate any health challenge, that you partner with someone who has a similar philosophy of care as you do with regard to your health, and that the things we talk about are just essentially tools to put in your wellness toolbox to help maintain and regain health if necessary. Just make sure that anything that comes across your radar as being new or something you haven't tried before, that you do your due diligence to know how to apply it, as well as to make sure it's something that is going to work well for you. Thomas Edison was a profound inventor in his time. 1903, he wrote that the doctor of the future won't be giving medicine, but will be instructing his patients, teaching them in the care of the human frame, in diet, and the cause and prevention of disease. And even before that, in 1885, it was noted that there's only one way of practicing the healing art that God approves: the remedies of nature that will not tax or debilitate the system, pure air and water, cleanliness, proper diet, purity of life, and a firm trust in God. Cleanliness was very, very powerful. This was it was post-Civil War, but during the Civil War, there was a huge amount of loss of life due to unsanitary conditions during the injuries and trying to help the soldiers. It wasn't until many years later that they began really taking to heart the sanitary measures that were necessary to make things successful in that regard. So fresh air, exercise, pure water, clean, sweet premises are inexpensive, but drugs are expensive both in money and in the effect on the body. 3 John 2 states that as your soul prospers, so does your health and your other prosperity angles as well. So make sure that your soul is prospering, and that's our spiritual life, essentially. Romans 12:1 and 2 says that we need to present our bodies as living sacrifices, holy and acceptable to God. So that's perfect and without blemish, to the best of our ability, with his help. It's our reasonable service. And do not be conformed to this world. Don't follow after the world, but be transformed by the renewing of your mind, that you may prove what is that good and acceptable and perfect will of God. And the ministry of healing states that because we are the temple of the Holy Spirit, as stated in Corinthians, that we're the temple of the Holy Spirit, that we should really pay really close attention to how we are fearfully and wonderfully made, and make our study how to understand and take care of our human body. So we're going to be continuing a discussion from last week in part 21 that was about tonic friction. We previously looked at the wet hand and the cold mitten frictions. The wet hand is used on people who are weak and infirm. The cold mitten friction is more powerful, has a higher reaction potential to it, and is useful, and is the most common one that's used, but used on people who have more vigor associated and can withstand that more fully. So the one we're going to start with today is called the cold towel rub. It's the third in a series of friction rubs, the first two being the wet hand and the cold mitten friction. The third one is the cold towel rub. So it's not as often used as the cold mitten friction, the wet sheet rub, or the salt glow. So the application is the same as the cold mitten friction, only it's using a hand towel instead of a washcloth or mitts. So there's a larger surface area that is working on the individual for creating the friction. So you need a pail or a wash bowl of ice water. So that's about 50 to 60 degrees. So it's not icy water. It's not like freezing water, but it's cold. A sheet, 3 Turkish towels, a small hand towel, wet compresses for the head and neck, especially if they have a fever and are ill with a fever, plastic sheeting, and a blanket to cover the bed, especially if they are in a prone position. You want to cover and protect the area that's being worked with the hydrotherapy. So the application, you want to apply it in a warm, draft-free room, just like the mitten friction. If they're having a fever, you want to make sure that you have a compress for the neck and face. If there's a heart valve disease or heart issue, you want to place a cold pack over the heart before the beginning. This can be given standing, and it can be done by yourself on a daily basis if you choose to. So wring out the cold, wet towels and then quickly rub, dry the person, re-dip it and wring it, and then rub, dry, dip, wring, etc. for 3 rotations. So everything's going to have 3 cycles. So rub, dry, re-dip and wring, rub, dry, dip and wring. And you're going to want to do it in a sequence, just like the mitten friction, cold mitten friction. You're going to do the arm and the forearm, rub it until the skin is nice and pink for several seconds, then dry it and cover it, move to the next limb, and dry and cover to the chest, dry and cover, and the trunk, thighs, legs. So each time you want to dry it and cover it so that they don't get chilled with a draft of any kind. So they're going to be in a draft-free room, ideally, that's already warm. So again, you're going to be doing the friction and then covering it right away after the conclusion of the rub. So the wet sheet rub is the next one. You're going to use this as a tonic in conjunction with the other friction treatments to improve health. So it's not necessarily done for someone who's sick, but someone who wants to improve their health. So the supplies you're going to use 3 wet sheets, a foot bath that's hot, 103 degrees Fahrenheit, a pail of water that is 60 to 70 degrees Fahrenheit. So we've got hot water, cold water, and then 2 light hand towels for a compress on the head, a pail of ice water. So we've got three different temperatures of water. You've got hot water, you've got cold water, and you've got ice water. And then a Turkish towel. So to apply the wet sheet rub, you're going to need a warm, draft-free room again. The individual should have really good circulation to begin with. If they don't have it initially, you don't want to conduct it. You don't want to do the wet sheet rub. So they want to already have good circulation happening. And one way to make sure that is at least moving is to do some light exercise prior to the application of the wet sheet rub so that they can get that circulation moving. So you're going to have them stand in a hot foot bath with a cold compress to the head. So the picture over here shows a person who's standing, and it doesn't show them here particularly standing in a basin of the warm water, but they should be standing in that basin of warm water with the cold compress, which we see applied here on the person's head. Lightly wring out the sheet in room temperature water, so that's the 60 to 70 degrees Fahrenheit water. And then quickly wrap the person. So you can see in the picture on the left, it's wrapped under the arms. They can lift up the right arm, put the sheet underneath, and they put their arm down to hold it in place, lift up the other arm, and then they can pin the sheet in place with their arms and then continue on around, raising the sheet up around the shoulders, behind the shoulders, over the chest and back, and then just do a complete wrap of the body and then tuck in between the legs at the lower level. So once that's been done, so here's showing the wrap from the other direction. A vigorous rub and percussion is given over the sheet. So you're not actually rubbing the sheet itself on the person, but the hands are going up and down on the sheet outside of the individual. You want to rapidly progress over the body in a similar way, although you're not exposing and covering like you do on the wet towel rub, but you're doing a whole body friction rub with the hands outside of the towel, and the sheet will rapidly warm over the person. So it's a cold sheet. It's been applied over the person, and then it'll warm up as they're done. You want to be attentive to their stability. Naturally, if they're standing in a tub of hot water, and this one's actually showing the hot water tub that they're standing in and the cold compress around the head, you don't want them to lose their balance and tip over. That wouldn't work out so well. So at the completion of the rapid rub down, unwrap and completely dry with a dry sheet and towels. So make sure the person, again, is warm at the beginning. One thing that will help that is the feet being warmed initially. Standing in that warm water, that gives an overall sensation of warmth. If the person is known to have a good reaction to the cold towel rub or cold pail pours or cold sprays, then you know that they'll have a good reaction to the wet sheet rub. Work quickly to keep from chilling. This shouldn't take very long to actually do the rub down and then get them dry and covered with a blanket. So they must have that warming reaction and start their circulation coming to the surface, and the blanket should warm up quite quickly. So it's the best applied with 2 people. So this shows the person that's being treated, it shows the attendant. There really ideally should be a third person there to and just maintain stability and aid with any supplies or other needs that are necessary. So when you're doing the next application, which is the dripping sheet rub, you're going to have, instead of a dry sheet, you're going to have a dripping sheet. So it's identical to the wet sheet rub with the addition of 2 pail pours. So this is getting more vigorous as we go up the scale here. Some additional supplies from the previous one, you're going to have 3 pails of cold water. And they're going to be 60 degrees, 65 degrees, and 70 degrees. So they're cold, but they're graded from cold to less cold to warmish. So room temperature suddenly is 70 degrees Fahrenheit. So the alterations from the wet sheet wrap to the dripping sheet wrap is the addition of the 70 degrees water. And when rubbing and the percussion is completed, instead of finishing with a dry and a covering with a blanket, you're going to pour a pail of cold water over them, the 65-degree water. So you started with the 65 degree, vigorously rub the second time, and then the third pail is going to be 60 degrees. So you're going from warm to cold. You'll pour that over them and rub for the final time until they're warm, and then finish with the drying as you did in the previous wet sheet rub. So this is the dripping sheet rub. You're going to be pouring these pails of water at different temperatures over top of the person, and the sheet is wrapped around them. It will drain down into the tub below. So this, you're going to need to have a nice big tub that they're standing in, or a tub within a tub, perhaps, to catch the water that is being poured over them, so that it doesn't get all over everything. But that'll create a vigorous warming reaction in the individual that's being treated this way. So the dripping sheet rub of the ones we've talked about so far is the most powerful of the severe of the friction rubs. Severe meaning challenging because they've got the 3 pail pours. It's as a tonic, the person should be able to accommodate it well. And a tonic is something that tends towards health. And it's a demonstrated heating with lighter methods. So using previous methods, they have good reactions to that. They'll probably have a very good reaction to the more vigorous methods. It's the strongest tonic that can be administered. Then we move to the ice rub friction, and it utilizes a piece of ice versus a hand or a towel. So some of the benefits of the ice rub friction are that it's fever reducing, and you can rub each body part for some time and then pat it dry. So this is for elevated fever. It's one other way to bring a fever down. You can also do that just directly to the spine area, the back. Is very powerful for reducing fevers. So to apply it, you want to rub sequentially over the arms and the legs, like you did in the wet hand and the mitten friction, covering each one after you dry it and complete it to prevent chilling further and prevent drafts. You're going to be more careful with the bedding because there's going to be more water with the ice melting rather than having just a damp mitten. You actually have water that's being produced through the melting process. You should put a Turkish towel around each limb that can help absorb the water. So you're going to need some additional towels for the ice rub. Wrap the ice in gauze or cloth to hold it securely while applying it, or you can use a disposable cup. So there's over on the right side, you can see a disposable cup that put that in the freezer. Could be styrofoam, could be paper. Styrofoam would be better for the person who's applying it because there's more insulation, but then just tear it down. And as the ice cup melts away, you can tear it down further, but that gives you something good to hold on to. So as a cold compress to the head, neck and heart region, you want to make sure that you do that. And if a person has typhoid fever, you don't want to apply the ice to the abdomen. So you can use, if you have a large chunk of ice, you can use cloth to put the ice in direct contact with the skin. You don't want to just hold it in one place. You want to move it around. It's not going to get frostbite or anything like that if you keep it moving. Or using the cup that you can tear down and apply the ice from that cube that's in the cup. And then we have the salt glow tonic friction. So it's a similar mildness and effect as the cold mitten friction, but there's less heating associated with it. So the salt glow is really good for people who don't react. The heating doesn't react well to the cold mitten friction. So it's more mild, but it is effective. You're not using very much water. The water basically moistens the salt. So you can see the salt here on this person's back is tacky and wet. So it stays in position, doesn't go different places, doesn't just run off them. So the water is really used to moisten the salt. So it's not as cold, but provides a good reaction. It builds resistance and improves circulation, and is great for improving strength, endurance, and immunity. So what you need are 2 pounds of coarse salt. Use a sea salt like Himalayan pink salt, sea salt, or Celtic sea salt. A foot tub of 105-degree water in a wash basin. 2 Turkish washcloths. A shower cap is an optional component, and a sheet. So to apply it, again, you want a very warm, draft-free room. You're going to moisten the salt with cold water. Not super moist. You just want it moist enough that it'll cling to the skin and not just run off. If it's too wet, it's going to limit the friction. So the salt is abrasive and going to be friction by nature. You can do an arm test on yourself first to see if the salt is at the right consistency with the moisture content. The person sits or stands with the feet in a hot water bath. So like the towel rub or the sheet rubs, they're going to be standing in or sitting in a foot bath that's hot. So wet the body with the foot tub water. So just reach down and bring up and wipe the water on, then evenly apply the salt and rub it in the various areas sequentially like you would with the mitten rub till the skin is pink. So right arm, right leg, left leg, the front trunk, back trunk, do that simultaneously. So just running the hams up and down the front and the back, and the side simultaneously as well. Then the hips, front and back of hips, and definitely want to be standing for the hip portion of the salt glow rub. So finish with a rinse off, a brisk towel rub, and make sure that they do at least 20 minutes of rest. So any therapy treatment with hydrotherapy, following it, you want to make sure that the person is resting adequately following, or it can actually negate any of the benefits that may be an outgrowth or a byproduct of having done the treatment. So just make sure that you get adequate rest following your treatment. So you can review this presentation again with the others in the series, along with other various components on preparingforthetimeoftrouble.com, sustainable gardening, Earth's final warning, and the 3 angels message, which is the time that we're living in right now, and homestead remedies of various sorts that can help you through periods of time when you don't have access to the traditional types of pharmacological agents that we're accustomed to in our society today.